So, in this episode, we'll discuss why it's important to understand these warning signs, the kinds of questions you can ask your provider, and how to feel more confident managing your condition. Hey folks, welcome back to Empathy in Practice. I'm Florence. I'm a nurse practitioner based in the US, and in this channel I help you have those important conversations with your provider, going over important questions to ask them so that you can be more confident in managing your chronic conditions. So this is the first episode of Managing COPD series, and today we're focusing on an important question every person with COPD should be asking their provider. How can I tell if my symptoms are worsening? So, COPD symptoms change gradually, and it's not always easy to know when you need that extra help. So, in this episode, we'll discuss why it's important to understand these warning signs, the kinds of questions you can ask your provider, and how to feel more confident managing your condition. Let's start by understanding why it's so important to recognize when your COPD symptoms are worsening. Spotting changes early can prevent complications, it can reduce hospital visits, and can help keep you healthier longer. For example, if you notice you're more short of breath than usual or you're coughing more frequently, it might be a sign of an oncoming exacerbation. This is when your COPD suddenly worsens due to inflammation or an infection or environmental triggers. What exactly is an exacerbation? Well, with COPD, in simple terms, it's a flare-up of your COPD that makes your symptoms significantly worse than your usual day-to-day baseline. Catching these early before they become severe allows you and your provider to adjust your treatment plan and keep your condition more stable. So what questions should you be asking your provider? First, what are the most common signs that my COPD is worsening? So your provider can help you identify specific symptoms to watch for, things like increased shortness of breath, a change in your mucus color or thickness, or more frequent coughing fits, or even a drop in your usual energy levels. When discussing the signs of worsening COPD, providers often emphasize certain hallmark signs. And these include things like increased shortness of breath or difficulty breathing, also known as dyspnea. So, one of the most common early indicators of a COPD flare-up or progression is that noticeable change in your breathing. If you find that activities you previously managed, like walking across the room or climbing a flight of stairs, suddenly leaves you winded, that's a red flag. And this occurs because COPD progressively narrows the airways and it reduces the lungs' ability to exchange oxygen and carbon dioxide efficiently. So, just a reminder, oxygen is the air that we breathe in, carbon dioxide is air that we breathe out. So over time, even small changes in inflammation, airway obstruction or narrowing, or the presence of mucus can make it harder to get enough air, and it results in that sensation of air hunger. So another thing is change in mucus characteristics. In other words, if the color, consistency, or amount of mucus changes, it could signal an underlying infection or a worsening of your COPD. For example, mucus turning from clear to yellow or green might indicate bacterial involvement. Thick mucus can also be a sign that the airways are becoming more irritated and inflamed, and these changes happen because the lungs' defense mechanism, like mucus production and ciliary movement, which are those tiny airway hairs that helps clear out mucus, they are already compromised in COPD. When the condition worsens, the airways may produce more mucus or struggle to clear it out even, which can further obstruct airflow or block your breathing. Providers can rely on these mucus characteristics as a practical indicator or that clear sign of exacerbation. As a side note, studies have demonstrated that patients who report increased sputum production or purulence are more likely to require antibiotics or steroids to manage those acute exacerbations. Another thing is more frequent or intense coughing fits. So a spike in coughing frequency or intensity can indicate that your lungs are struggling more than usual. And this can happen when irritation from pollutants, allergens, or infections leads to increased swelling in your airway. And so, as the airways swell or produce more mucus, the body's natural response is to cough in an effort to clear these blockages. If you're coughing all the time, that could be a sign that the airways are not staying open as they should, and this often means that the disease is progressing. And according to evidence-based treatment guidelines, frequent coughing combined with worsening sputum production is that strong predictor or a clear sign of an acute exacerbation, which may require a change in the treatment regimen that you have currently, such as, starting a short course of oral steroids or antibiotics. Another thing is a drop in usual energy levels, that fatigue. So, fatigue is another common symptom that can indicate worsening COPD. When breathing becomes harder, it takes a greater physical toll. So, your body expends more energy or uses extra effort just to maintain oxygen levels, leaving you feeling drained. And lower oxygen levels or higher carbon dioxide levels can directly affect energy levels and cognitive function, or your brain functions. Again, as a side note, studies have shown how even mild increases in dyspnea and work of breathing can lead to that significant reduction in physical activity and overall energy. Patients who often report new onset or worsening fatigue often benefit from adjusting their COPD management plan, which can include things like the use of oxygen therapy or pulmonary rehab exercises. So, a provider might explain these signs as follows. If you're finding that activities that you used to do, like walking to the mailbox, are making you unusually short of breath, that could be a sign that your COPD is getting worse. You should let your provider know right away so you can adjust your treatment. Another, changes in your mucus, like if it becomes thicker, turns yellow or green, or if you start producing much more than usual, that can mean that there's an infection or increased inflammation. So it's important to address this early to prevent a more serious flare-up. If your coughing becomes more frequent or harder to control, that may mean your airways are becoming more inflamed or irritated. So your provider might need to keep an eye on that and see if they need to modify your medications. So, feeling more tired than normal, so much so that you struggle to get through your day to day, can be a signal that your body is actually working harder to breathe. That's something that should be discussed with your provider because it might mean your condition is changing. Here's another great question. How should I track my symptoms at home? So, tracking your symptoms at home is actually a proactive way or an early action for you to understand and manage your COPD, and your provider can offer evidence based strategies to do so effectively. So, here is what your provider might suggest: keeping a daily symptom journal. Recording your day to day experience of symptoms such as shortness of breath, coughing, fatigue, and mucus production. This can help you and your provider identify patterns and detect early changes. So, for example, if you notice increased shortness of breath over a week, or a gradual change or a change over time in the color of your sputum, it might signal a worsening of your condition or the onset or beginning of an infection. Why this works is that patients who regularly track their symptoms often recognize exacerbations earlier, leading to faster medical intervention. So, what your provider might say to you is something along the lines of jotting down how you feel each morning and evening can help them catch problems early. For instance, if you see that your breathlessness is gradually increasing or slowly rising, it's worth discussing before it becomes severe. So, using a pulse oximeter to monitor oxygen levels. So, a pulse oximeter is a simple device that you can use at home to check your oxygen saturation, which is that oxygen level in your blood. By tracking your numbers consistently, you can actually spot declining or dropping oxygen levels before you start feeling noticeably worse. A normal reading is generally around 95 to 100%, though people with COPD often have lower baselines. If your saturation levels drop significantly below your usual range, it may be time to reach out to your provider. Why this works is that home monitoring of oxygen saturation can help predict exacerbations and guide timely interventions. So, patients who regularly measure their oxygen levels and understand their baseline can take quicker steps to prevent complications. So, what your provider might say is along the lines of a pulse oximeter can give you a real time look at how your lungs are actually functioning. If you see your oxygen level dropping below a certain point, it's a clear signal that we need to adjust your treatment plan. Measuring exercise tolerance. So, one practical method is to know how far you can walk or how long you can perform a simple activity, like walking up a flight of stairs or strolling around the block, before needing to stop and rest. Over time, if you see that the distance or time is decreasing, it could mean your condition is worsening. Why this works. So, reduced exercise tolerance or less ability to exercise is a leading indicator or main sign of COPD progression or worsening. By tracking changes in your ability to perform daily activities, you can detect early signs of a decline. If you find you're stopping to catch your breath after shorter distances than usual, it's something that needs to be mentioned at your follow up. Additional provider recommended tools that your provider might also suggest are using simple checklists or those digital symptom tracking apps designed specifically for COPD. These tools can help you set reminders, graph your symptoms over time, and share that data with your healthcare team during those visits. In case you want to know, some providers recommend validated symptom scoring symptoms like the COPD assessment test or CAT, or the Modified Medical Research Council MMRC dyspnea scale, which can be completed regularly at home and provide structured, evidence-based insights into your disease progression. And so by following these evidence-backed methods, keeping a journal, monitoring your oxygen levels, and measuring your exercise capacity, you'll be able to stay one step ahead of your COPD. In turn, this information helps your provider refine your treatment plan, potentially preventing exacerbations and improving your overall quality of life. Next, at what point should I call the clinic or go to the emergency room? So it's important to understand the difference between a mild increase in symptoms that can wait until your next appointment and a serious flare-up that requires immediate attention. So understanding when to call your clinic or head to the emergency room is an important aspect of managing COPD. So when you ask, at what point should I call the clinic or go to the emergency room, your provider can give you guidance on distinguishing mild symptom changes from serious, potentially life-threatening flare-ups. So what a provider might say in recognizing mild symptoms that can wait is that if you notice a slight increase in shortness of breath that's not persistent, or if you're coughing a bit more than usual, but it's still manageable with your rescue inhaler, you may just need to monitor the situation and bring it up at your next visit. Minor changes can be common, especially if you've been exposed to a trigger like smoke or cold air or allergens. It's not unusual to have occasional off days, and these can often be managed with adjustments to your usual treatment plan. By learning your baseline, you can differentiate these minor variances or changes from more concerning signs. When to call the clinic. So you should call your clinic if you're finding that your rescue inhaler isn't working as well as it usually does, or if your symptoms are gradually worsening over a few days. For example, if your coughing becomes more persistent, you're producing a lot more mucus than normal, or your oxygen levels are dipping lower than your baseline, then that's a time to let your provider know. This might mean that your medications need adjustments, or you may need a short course of steroids, which is that strong medicine to reduce the swelling in your airways, or start on antibiotics. So calling your provider early when symptoms worsen can prevent an exacerbation from escalating into a full-blown emergency. Providers often recommend a phone call at this stage so that they can assess the need for an in-office evaluation or changes to your treatment regimen. When to go to the emergency room. If you experience sudden or severe shortness of breath that doesn't improve with your usual medications, if you're having chest pain, or if you feel so weak that you can't stand or speak in full sentences, you need immediate medical attention. Also, if your lips or fingernails turn bluish, or if you're feeling confused or lightheaded, these are signs that your oxygen levels might be dangerously low. In these cases, don't wait, go to the emergency room. So how do these symptoms arise? Let's break it down into 3 parts. First, mild symptoms. These might arise from transient exposure or temporary contact to a known irritant, weather changes, or a mild viral illness. In these cases, you might feel off, but your breathing, coughing, and energy levels remain manageable. The airways may be slightly inflamed, but not enough to cause significant airflow obstruction. Worsening symptoms is when you call the clinic. When your airways become more inflamed or filled with mucus, breathing gets harder. For example, a bacterial or viral infection sets in, you'll likely produce more sputum and experience increasing tightness or shortness of breath. So at this stage, the increased work of breathing may lead to fatigue, and your usual medications might not fully relieve the symptoms. So emergency symptoms. These are severe symptoms that occur when airflow is critically restricted, often due to a combination of airway inflammation or swelling, bronchospasm, and mucus plugging. In other words, severe symptoms happen when breathing passages get very narrow, often because of swelling, muscle tightening, and mucus buildup. If your oxygen levels drop dramatically, it can lead to hypoxia or low oxygen in the blood, causing confusion, cyanosis, which is the bluish skin, and a sense of air hunger. This progression can happen quickly, which is why immediate medical intervention is absolutely necessary. By understanding these distinctions, mild symptoms that can wait, signs that call for a clinic visit, and red flags that require emergency care, you'll be better prepared to respond to change in your COPD. Your provider's advice, backed by guidelines and studies, helps you know when to pick up the phone and when to go straight to the ER, ensuring that you receive timely care and prevent serious complications. Finally, ask, what should I do if I notice these warning signs? So your provider might suggest adjusting medications, starting a rescue inhaler, or coming in for an urgent checkup. Knowing this ahead of time takes a lot of the guesswork out of managing your condition. So what a provider might say is, when it comes to adjusting medications, if you notice a gradual increase in shortness of breath or more frequent coughing, it might be time to temporarily adjust your medication routine. So this could mean using your maintenance inhaler more consistently or adding in a short course of oral corticosteroids or antibiotics. If an infection is suspected, don't hesitate to call if you're unsure whether a medication change is needed. Guidelines recommend early intervention with medication at the first signs of worsening symptoms. So studies have shown that initiating or starting appropriate treatment quickly can shorten the duration of exacerbations and then reduce that need for hospitalization. When it comes to starting a rescue inhaler, when symptoms come on suddenly, like unexpected shortness of breath or a sense of tightness in your chest, using your rescue inhaler can help you regain control. Make sure you're familiar with the correct technique, and if the inhaler doesn't provide relief after a few uses, it's time to contact your provider for further evaluation. If your symptoms aren't responding to your usual medications, or if you're noticing concerning signs like that change in mucus color or increased fatigue or persistent shortness of breath, schedule an urgent appointment. So your provider might need to adjust your treatment plan, perform a lung function test, or check for signs of infection. So early intervention at a clinic can prevent a moderate exacerbation from becoming severe. How do these symptoms arise? So when COPD symptoms worsen, it's often due to an increased airway inflammation, mucus production, or bronchial constriction or narrowing. For example, inflammation and mucus. So irritants like pollutants, cold air, or respiratory infections can cause swelling in the airways and stimulate excessive mucus production. So as the mucus thickens or becomes more abundant, it blocks airflow and makes breathing harder. This buildup can also trap bacteria, leading to infections that further worsen symptoms. Bronchial constriction, so narrowing. In response to irritation or infection, the smooth muscles surrounding the airways can tighten, can cause bronchospasms. This reduces the diameter of the airways, making it difficult to exhale properly. The feeling of shortness of breath is often a direct result of these narrowed airways. By asking your provider what to do when these warning signs appear, you'll receive a clear step-by-step action plan, and this might include increasing certain medications, using your rescue inhaler correctly, and knowing when to schedule an urgent appointment. So when you have this knowledge, you can confidently manage your condition and reduce the risk of serious exacerbations. So let's talk about how to bring up these questions with your doctor. So it's okay to write down your questions and concerns before your appointments. So a simple list can help you stay on track and make sure that you don't leave feeling like something was missed. Be open and honest about what you're experiencing, even if it feels minor. Sometimes small change can be the first clue that something more serious is actually happening. And remember, your provider wants you to succeed in managing your COPD. Don't hesitate to ask for clarification if you don't understand their instructions. They're there to help you, and asking questions shows you're taking an active role in your care. So I just want to wrap up with a few encouraging thoughts. So COPD is a tough diagnosis, but you don't have to face this alone. When you ask your provider these important questions, you're building a partnership that helps you stay ahead of the disease. Every time you recognize a subtle or small change and address it early, you're taking a step toward better health and a higher or better quality of life. So at your next appointment, take that deep breath and ask your provider, what should I watch for? It's a small question, but it can make a big difference. Thank you for joining me on this episode of Empathy in Practice. I'll see you next time so we can continue exploring the questions that can help you manage your COPD with confidence and compassion. If you found this video helpful, please don't forget to subscribe and pass it along to someone who might benefit from this information as well.